caring hand. We're here to help, we understand. From home to healing, near or far, you're in great hands with Concierge Star. Concierge Star nursing care that shines so bright. Professional, compassionate day and through the night. Health, comfort, peace of mind. We're with you every day. Concierge Star nursing, your care, your way.
And welcome back, everyone, to Concierge Star Conversations, Episode 4. I'm your host, Mark Martin, and we have our infamous CEO and founder of Concierge Star Nursing, Tamika Brown, RN.
Welcome back. Welcome back.
Today, what we'll be talking about is things patients do that nurses will never forget. Tamika, let me ask you,
Sure.
after all these years in healthcare, do nurses really forget their patients?
No.
Really?
No. People think we forget because we see so many patients, but there are patients who stay with you forever.
Is it because of their illness?
Sometimes, but more often it's because of the person.
I love that.
You remember kindness, you'll remember courage, you'll remember families, and you definitely remember laughter. Sometimes you even remember funny moments that happened during really stressful days.
And I think that's what people don't see. Nurses isn't just medication, it's a relationship. And I think that's what people don't see. Nursing isn't just medications, it's relationships.
Exactly.
So that brings us to our first topic, patients who think they're a burden.
hmm
Now, I hear that all the time. I don't want to bother you.
hmm
Where does this come from?
Well, typically, I think people see nurses moving constantly, like we do. We're walking super fast. We may be answering call alarms. We're at the desk charting. We're on the phone talking to doctors. We're helping family members. So they just assume I should just wait.
But waiting can actually make things worse.
Exactly. Like if you got to go to the bathroom and you need assistance to get to the bathroom, you don't want to wait till the last minute where you're going to be in a tight. Now you have to try to rush to get to the bathroom and you may slip and fall. Pain medicine, you don't want to wait till your pain is at a 10 and now we have to rush to bring your medication. It's got to bring you all the way back down to where we could have just gave you something at a pain level of 5 that would have helped ease you on down where you're
Right.
not in so much pain. Somebody feeling dizzy, getting out of the bed, you're trying to get out of the bed and you're dizzy, you're risking another injury
hmm
or you're risking a new injury.
hmm
Somebody that's short of breath, you don't want to wait, you be out of breath and dead.
Right. Right.
So
And
some of these things you need to get the attention that you need quicker than other things, but you definitely don't want to wait till the last minute to do some of these things and ask for help. You want to
or
go
to
ahead,
even think that you're a burden.
right? Or even just simple things like questions about your medications.
hmm
You just ring and find out. Somebody will come, and if you in a place like some of these facilities, you're in a place that you've been ringing per se for 10 minutes. Help! Somebody coming. I promise you, somebody gonna come.
Right. Right.
May even be a housekeeper, but somebody's coming.
Right.
So I remember taking care of a patient who kept apologizing every time they used the call light. Finally, I told them, this is literally why I am here.
Okay.
And they laughed. But after that, they stopped apologizing.
Right.
Yeah, because
Exactly.
that's what we're here for. You ring the light, we're here to answer it.
And I'm sure they felt much better.
Oh, they did. And sometimes patients just need permission to ask for help. Have you ever felt guilty for calling your nurse?
Yes. Matter of fact, my last hospital stay, I felt that I didn't require as much attention
Mm-hmm.
because I'm so used to being able to do things on my own. It wasn't like
Right.
I was bedridden.
That's that independent mind.
Right, right.
And
So,
like most people come in with, they were independent previous to them getting hospitalized, and now they have to depend on somebody. So yeah, I could
and
see
that takes a lot of humbling.
it
I'm
do.
just speaking from experience. You
It
know,
do. Yeah.
to have someone, to have to wait on someone to come, help you do something, and you've always had it in your mind, oh, I can do this on my own.
Right. Right.
So that takes us back to, you know, uh, calling out for your nerves
Right.
to alleviate extra problems.
Extra problems.
Mm,
Yeah. Yeah. And doing that, it helps in so many ways.
absolutely.
Sometimes patients just need permission to ask for help too.
So now that we've talked about asking help from your patient,
Mm-hmm.
I'm sorry, from your nurse,
Mm-hmm.
let's talk about the Google patient.
Oh Lord. Oh yes. The Google patient.
I think every nurse has met Dr. Google.
Oh yes. We have. We
You,
have.
you walk in and the patient already has 17 possible diagnoses,
17.
and none of them apply.
And 3 of them are from TikTok.
Right.
So listen, family out here. We do not want to be on Google, Facebook, TikTok, Reddit, any of these places trying to diagnose ourselves. Okay.
Wikipedia.
Yeah, we don't want to be doing that. You got some medical influencers out here as well. They'll tell you about some things, but be leery of who you're listening to. Make sure you're cross checking these folks and everybody's credentials are matching up, because some people are doing just that. They're Googling, Facebooking, TikToking, and putting information together to give to you all, and it's not actual factuals.
Right.
So, you want to be careful about that. And sometimes you wonder why your anxiety increasing. It's increasing because you're on Facebook and Google and TikTok and Reddit and all these other places, Wikipedias, and you're trying to diagnose yourself when all you need is a simple phone call to your MD.
Right.
And
And
actually,
some of these doctors or offices have portals now where you can actually send the question to them.
Right.
Now,
And
you might
somebody
be a
will get
little
back to you.
anxious waiting for them to get back to you.
Right.
But rest assured, you're going to the right place
Right.
in order to get the correct answer.
Correct answer. And then you know what your doctor's qualifications are. They're already set up for you. So I would be cautious about Google searching things about your health. There's nothing wrong with it, but you just want to be careful on what you're listening to and the advice or recommendations that it's giving you, because not everything is accurate out there on the internet.
Now, let me ask you, Tamika, have you ever had someone convince themselves they had something completely different?
Oh, absolutely. And honestly, sometimes they're scared. Google gives you the worst case scenario if you didn't know.
Exactly. And when you go search, you have a headache, Google says, prepare your will. It already has you laid out in the casket.
In the casket, clean. And headaches can happen for so many reasons. That's why it's important to let qualified healthcare professionals, again, evaluate your symptoms rather than assuming the worst based on a simple internet search. We're not saying don't research. We're just saying know where your information comes from. That's all.
Correct. So now let's talk about the pain scale.
Oh, I knew this one was coming.
So your pain is a 10 out of 10.
While eating fried chicken.
Boy, that chicken was good. Oh, I'm sorry. But we've all seen it.
Oh, yes, ma'am. And pain is personal. There's no perfect way to measure it. Everyone experiences pain differently. I'm just saying.
Correct.
So, nurses, we're going to ask, what's your pain level? We have to know what's your pain level for so many reasons. How your pain is assessed. Observing you, talking to you.
Right.
You telling us communication is the best way to assess the pain, We feel around and dig into what you're talking about, and we make it make sense.
Right.
Right. What the scale means. The scale is just something we go by that kind of tells us what type of pain you're in. You may get a facial pain scale that may say you're sad, or you're feeling really bad pain, or you want to cry pain, those type of things. It's just a measurement of how bad your pain is. That's all the scale really is. And then to make it easier on both the nursing staff and the patient, be honest about your pain.
Mm-hmm.
If you're in pain, be honest about it. I'm in pain. We do have pain seekers, pain pill seekers, I should say. They come and they go. I've ran across a couple in my years of working, and I know we've caught people trying to move medications outside of the facility to their family members. So you just have to be honest about it, and nurses have to be on all 10 toes about when this is transpiring, and watch their patient, observe their patient, because every patient is not honest. It's sad to say, but every patient is
Right.
not honest. And pain goals, we want you to have good pain goals, meaning a 5 out of 10, that's tolerable. A 6 or 7, how you say your pain goal is,
Mm-hmm.
a 8, you can still function.
Mm-hmm.
So that's what we mean by when we say pain goals. What is your pain goal? Not that we want you to be in pain,
Right.
but if you have to be in pain because of whatever's going on with you, what is your pain goal that will make life tolerable for you? And then we work from there to keep you at that pain level,
Mm-hmm.
or below,
Mm-hmm.
so that you can have some form of a normal life or normal activity going on in
Right.
a daily situation.
Because if you wait and let the pain increase, then your anxiety increases,
everything's
and
going to
then your
increase.
mental is off.
Yeah,
and you're not able to function.
You're not going to have a productive day at all.
So
Exactly.
again, you don't exaggerate, but you don't minimize it either.
Exactly.
So this brings us to our topic 4 about families.
Mm-hmm.
Families deserve their own episode, if you ask me.
They really do. They really do. Let's talk about the families who never leave.
I was one of them.
No, the ones sleeping in the chairs?
Yeah, renting a blanket.
Oh, ordering Uber Eats.
Mm-hmm. And protecting their loved ones.
That's right. I love seeing families involved, though. How families can help. Families, you can always help. If you're in with your person, you're in the hospital, you're in a rehab, just know what's going on with your person. That's helping enough. If a nurse comes in and needs to know something, your person is in so much pain that they can't communicate or they can't give the answers that's needed, that's when you come in. You take some of that pressure away from them, and you give those facts that the staff needs to continue on with the care for your person. Communicate. You've earned the respect and trust from your person, and now you want to pass that over to your nurse now, so that you can get their respect and trust, and everybody's one big happy family in the room. Because that's how I look at it. When I'm in the hospital, or I need to go somewhere like that, I want to be able to trust my nurse. I want to be able to know that I respect her, she respects me. It's both ways, and we can go get to the bottom of what we're trying to get to.
I can definitely agree with you
Yeah.
on that, because now I'm thinking back. My little story to add to our conversation. When my son was in a motorcycle accident, and it was one nurse. I mean, he had umpteen nurses, but it was only one nurse that I felt comfortable enough to leave the room and go tend to myself, and I knew
You
she
had that trust for her.
Yeah.
And you gained that respect, and
Yeah.
she got it for you, and you felt that. So, and you want to make sure when you in these situations, you asking questions. Write notes if you have to. If then you write notes and you ask the questions later.
Right.
However, you want to be a part of your care team is basically what I'm trying to say. Be a part of your care team. You want to be that liaison between the healthcare and your person.
Right.
Yeah.
And were you ever the family member who stayed overnight? I know I did.
Oh, heck yeah. Oh, heck yeah. I'm there. You might well put me in a bed. Right,
and that's what they did.
Right next to him.
That's exactly what they did. They
sure.
It wasn't the most comfortable, but for
worked.
the sake of our loved ones, we're going to do what we need to do.
Yeah.
So that brings us to topic 5. The patients nurses never forget. Okay, now this one might get a little emotional.
You probably will.
But what makes someone unforgettable?
It usually isn't what people think. Sometimes it's the patient who made everyone laugh.
Right.
Sometimes it's someone who encouraged the staff while they were going through a difficult time. And sometimes it's simply a person whose kindness left a lasting impression. So, it just all depends.
Right. I think people forget that nurses are human too.
Oh my gosh.
Mm-hmm.
We celebrate. Yes, we do.
Mm-hmm.
We cry like everybody else.
Mm-hmm.
We worry and we worry hard.
I'm sure.
We pray and we pray even harder.
Mm-hmm.
We laugh and yes, ma'am, we are definitely human.
And that's what makes nurses so special because, despite the times that we're living in where we're seeing AI taking over everything,
Right.
robots taking over everything,
Right.
at the end of the day, who wants a robot to come say, "What's your level of pain?" And then the next thing you know, it's a little pocket opening
Right.
and spitting out
some pills. No comforting rub on your shoulder.
Or encouragement that everything's going to be okay.
Right.
You're going to get better.
Right.
Just stick to the plan.
They say AI taking over, but AI will never really take over because there's some things they can't not do as a human, and emotion is one of them.
Right. So let's talk about. Let's do some hot seat questions.
Okay.
Have you ever cried at work?
At work? Maybe after work.
Yeah.
I don't think I cried at work, but maybe after work. Well, no, I don't cry at work too, but it probably wasn't it probably was about a patient. 9 times 10, probably about somebody passing away. Because I've had a couple clients that passed away while I was at work, and it was pretty sad. Even some of them I may had to even coast on over, sit in the room next to them and soothe them, and I'm actually watching them go to the other side. So yeah, I may have cried at work a time or two. Definitely after work.
Right. Which brings us to the second hot seat question. Your hardest goodbye.
Oh, my hardest goodbye was one of my little patient. She was over 100 years old, and she was so special. She been around for a good while. The time that I worked at this facility, and she finally passed away one day. And I wasn't even there when she passed, but when I heard about it, I was so sad. I was so sad. It was my girl. Yeah, so I can't say her name, but that was my girl.
I can understand. I can understand. Your most rewarding moment.
Ooh, my most rewarding moment was when I performed CPR after 5 people performed CPR on this one patient, and I was the one got him back. He came back to life, and he lived another 6 months on this earth.
Oh, that is awesome.
That was my most rewarding moment. Yep. And at that time, I wasn't even a nurse yet. I was a CNA. But as CNAs, we're trained as CPR.
Right.
So, yeah, that was very rewarding for me.
Wow. And what keeps you nursing?
My heart. I'm just a compassionate, caring person. I love what I do, and I'm all things nursing. Whether I'm in the facility, around the facility, or out the facility doing my own thing, I'm always all things nursing.
And I can contest to that.
Right?
Definitely. When I have a question, Tamika.
Hello, I got you.
This is what's going on. Tell me, or better yet, what should I ask my doctor?
Right? I got you. Let me give you a pointer.
And what's one lesson every new nurse should know?
So have patience for your patients. Have patience. You got to make some time for them. Everybody's on a go rush schedule. I got to do this. I got to do that. But you got to make time for your patients. One thing I should tell the nurses, and I still do. If you take time with your patients, 5 minutes in the beginning, 5 minutes in the end of y'all conversation, just to let them vent. Let them tell you what they want instead of trying to direct them on what they need to do because of your plan of care. You will have so much more better results with that patient because they're telling you. They're telling you, and all you got to do is listen. All you got to do is listen. And 9 times 10, they're going to bother you less too because you sat there and listened to them.
Right.
The ones that I've learned that patients will ring on are the ones that least attention. They feel like the nurse is just in and out of their room and they don't want to hear nothing they got to say. Mm-hmm. And I've been that fall guy nurse. When I walk in the room, it's like they tell me the story of the nurse that came in prior to me. And that's what they'll say. She act like she ain't have no time, or he ain't want to stay and listen to what I had to say. So I'm that person. I'm going to listen because 9 times out of 10, it's something I need to know, and it's going to make my job or my day easier with this patient.
Right. And not for nothing, a lot of people, once they become hospitalized, the family doesn't come around.
Right.
And
So
so
we
they feel
become
alone.
family, yeah, and then
Right.
we end up becoming the family.
Right.
So it's just, I mean, it behooves everyone.
Mm-hmm.
If you just stay within that circle of your patient, and make that bond. I know we have 20, 30 patients sometimes, those that are us that works in facilities, but some of these people just need that extra the extra 2-3 minutes to just explain themselves on how they feel, and you give them that comfort, and you'll see a difference in your patients.
So this week I thought about bringing in something different. Nursing mythbusters.
Okay.
So patients think nurses sit all day.
To reality, not. That's something we definitely don't do. Sit all day, we run all day.
Right. You always have to have a good pair of shoes.
Always have.
I'm sorry, sneakers.
Sneakers.
Or as some people will say,
okay.
Tennis shoes.
Listen, you gotta. If your closet is not built for it, and you coming in the nursing, just know you finna become a part of the sneaker gang.
Right. Because you'll be running every day.
Every day.
Now, patients think doctors do everything. Reality?
Reality, not.
Right.
Okay, doctors definitely don't do everything. Doctors do what they need to do, which is a whole lot, because they diagnose and they take care of the problem. But you think about it. When you're in a hospital, who do you see the most?
Nurse.
Okay, so that sums up that question real quick.
Right. Now, patients think nurses know every answer immediately.
Oh, no, we don't. That's definitely, in reality, we do not know every answer immediately. Some answers we have to go and find out.
And you know what? I respect a nurse that will tell me, I don't know right now, but let me get back to you.
Let me get back to you.
Right.
And it's no problem. I'm going to get back to you.
Right.
I'm going to find that answer for you. But I ain't going to sit there I'm not going to sit there and just tell you anything.
Right. Because then you raise a whole other, mess. But also, patients think healthcare is one person.
Reality? Not.
Absolutely not.
Healthcare is definitely, there's levels. It's a lot of people you're going to have to see during healthcare. I mean, from your MDs to your nurses to your dietitians to your floor techs to your CNAs to your, pharmacists. Well, you really won't see, sometimes you will see a pharmacist in healthcare. At some point, you will see a pharmacist. Whether it's after you leave the hospital or they're in the facility or whatever, you'll see one. Mm-hmm. But it's a lot of levels to healthcare, and you will see a lot of people. It's a lot of hands involved. Some of them you won't even see, like your admissions people. Most of the time you don't see them. But you got case managers that's handling everything, and they're appointing all these people to your case, even the specialists.
Right.
So yeah, it's a lot of hands in on your healthcare.
Right. And public education, before you leave the hospital, you want to make sure that you understand your medication list.
Mm-hmm.
Don't just throw your discharge papers on the kitchen table.
Please don't do that.
Because it's so important. It has everything that you need to know and how to do it, when to do it.
Yeah. Like knowing your follow-up appointments.
Right.
Knowing your emergency numbers.
Right.
Understanding your new medications that you just got from being released from the hospital. Mm-hmm. And knowing who to call if something changes.
Right. And most importantly, if you have a question and you can't get to that person right then, write it down. Write it down.
Write down questions. And when you call the person, you got your list right there, so you can just roll them off, whatever you need answered.
Or if you have access to the portal,
yep.
Go to ask the section where you ask questions.
Mm-hmm.
Yeah, that's most important.
Yeah.
Because again, because you're leaving the hospital doesn't mean your hospital stay is over.
It's not over.
Now
we talked about in the last episode or so about recovery starts at home.
Yeah.
So we're back to that again. Before you leave the hospital, know what you need to do, and when you get those discharge papers, make sure you read over them and know everything is on the list that you need to be doing.
Right.
And if you feel something's not there before you leave, again, ask those questions.
No question is a dumb question.
No question is a dumb question.
And I was always told, a closed mouth don't get fed.
Period. Point blank.
Yep. Don't think your question is dumb. Please don't.
Please don't. Never be afraid.
So we're coming to the ending, but before we do that, let's do some real talk.
Okay.
If there was one thing you could tell of every patient in America, Tamika, what would it be?
Um, I'd probably tell them never be afraid to ask questions.
That's most important.
Yep, healthcare works best when patients and healthcare professionals communicate openly. Um, your voice matters. Everybody's voice matters. Everyone we come in contact with, their voice matters and their concerns matter. So that goes back to me saying patience and listening to your patient. All these things matter. And asking for clarification is the one of the best ways to take an active role in your care.
I agree.
Yeah.
I agree.
So we are definitely at our closing now. Um, We just like to thank everyone that has joined us today and listening to our podcast. We're still growing, guys. We're on episode 4. Today was about things patients do that nurses will never forget. And I myself am a nurse, and I have a lot of stories about it. We're going to be bringing more episodes like this to you weekly. Every Sunday evening, we'll post something new. If you guys have any questions or you have any concerns that you would like us to talk about or bring up in our next episodes, drop it down in our DMs. If you have a question like, what's one thing a nurse did that you'll never forget? Or what's a funny moment from your career that still makes you smile if you're a nurse? Put those down in our comments and you may see your question and answer on our next episode. Make sure to follow, like, and share us on all of the platforms. Definitely subscribe to our YouTube channel so that you can catch these podcasts every week and don't miss out on anything good. Okay? So, again, in closing, this is your nurse, Tamika Brown, and your host, Miss Marquetta Martin. We had so much fun with you guys today, and until our next time, this
Okay.
has been a Concierge
Concierge,
Star
concierge,
Conversations, and we're gonna care with heart
and
and
lead
lead
with
with
purpose.
purpose.